mynews.studio.
Two countries that once faced the threat of widespread blindness now have a future without trachoma. How did they manage this?
Today is June 7th, 2025. Trachoma, a disease caused by repeated bacterial infection, has officially been eliminated as a public health problem in both Papua New Guinea and Mauritania. This isn't just another headline. It's a significant moment in the ongoing effort to prevent avoidable blindness. Let's unpack what this actually means and why it matters.
First, let's get specific. Trachoma causes blindness through repeated infections that scar the eyelids. Over time, the scarring makes eyelashes turn inward, which then scrape the cornea. If it's not treated, blindness can't be reversed.
Yes, that's right. What stands out is how large-scale the interventions needed to be. The World Health Organization's safe strategy, surgery, antibiotics, facial cleanliness, and environmental improvements formed the core. But I'm wondering, was it only about medical treatment?
No, actually, it went far beyond medicine. In both countries, improvements to water and sanitation infrastructure were just as important as antibiotics. For example, in some of Papua New Guinea's remote regions, simply providing clean water reduced the spread of bacteria. But delivering antibiotics or building latrines in difficult-to-reach areas, how do you even begin with that?
That's where local partnerships made a real difference. Papua New Guinea's government worked closely with groups like the International Trachoma Initiative, shaping outreach to fit each area. In Mauritania, they faced a different obstacle: nomadic communities. So, door-to-door campaigns in regions like Adrar and Tagant became essential. But for a population that moves, how do you reach everyone?
It's a real logistical challenge. They used mobile teams, sometimes literally following migration routes. Community health workers became crucial, not just for distributing antibiotics, but also for education and tracking cases. This wasn't something that happened overnight. We're talking about years, even decades of sustained work.
Let's add some context with the numbers. The World Health Organization sets the bar at less than 0.2% of adults with unmanaged trachomatis trichiasis and under 5% of children with active infection. Plus, there need to be systems in place for continued monitoring. So, elimination doesn't mean zero cases.
Right, it means the disease no longer poses a public health threat, but ongoing vigilance is still needed.
Exactly. Now, what about the bigger picture? Do these efforts only impact trachoma?
No, the effects go much further. Cleaner water and better hygiene benefit overall health. Reducing trachoma also cuts down on other diseases. It shows that neglected tropical diseases aren't an inevitable part of life for the world's poorest communities.
Looking globally, the number of people at risk for trachoma has been falling fast. Countries like India and Mali have also achieved elimination. The World Health Organization aims for global elimination by 2030. Do you think that's realistic?
It's an ambitious target, but with each country that succeeds, it feels more achievable. Still, there are real challenges: sustained funding, reaching remote populations, and keeping communities engaged over the long term. For other countries, what's the best path forward?
I think adaptation is essential. The safe strategy is effective, but it has to be tailored. Different regions have different needs, cultures, and health systems. Continuous monitoring and fast responses to any new cases are crucial. And maybe most importantly, communities need to be active participants, not just recipients.
So, eliminating trachoma in Papua New Guinea and Mauritania isn't just an end, it's also a starting point. It shows what's possible when science, policy, and community efforts align. Could this be a model for other preventable diseases?
That's the key question. If we apply these lessons, long-term commitment, local adaptation, and broader health improvements, there's real potential to tackle other neglected diseases. But it will demand the same dedication and teamwork.
That brings us to the end of our look at how Papua New Guinea and Mauritania tackled trachoma and what it could mean for global health initiatives.
From antibiotics and water systems to local health workers and international targets, every element played a role. Thanks for tuning in.
And thank you for listening.
This episode was brought to you by mynews.studio. Try it today for free.